What is the very worst thing that's happened to you as a result of the stroke? What's the very worst thing that's happened?
The hoist for me, when I needed to go to the bathroom. I absolutely hated that. Absolutely hated it.
What, the incontinence you mean? Or
The machine.
Well, the indignity.
Indignity.
It's a machine. You lift it up out the bed. We all had it. Because you can't walk, and it's to get. I mean, that's when you become conscious, and you have to. The nurses, 2 nurses come. The nurses are lovely, but I absolutely hated that. I just hated it. Yeah.
yes.
I just dreaded it, and
having no control over your...
for ladies as well, you've got your legs stronger.
Yes.
It's just so indignant. It's just awful. Hated it, absolutely.
Yes, so for you, the inability to be able to do those things for yourself was really, really a problem. Yes.
That was the worst. Yeah.
Yeah. What was the very worst thing for you?
The very worst thing is the energy level.
Energy level, yeah.
I haven't reached my pre-stroke energy level. And like when I do physical work, I just get tired very fast. Yeah.
And has that ameliorated any at all, or has it remained fairly constant? That
Well, it's had been slowly coming back, but it took months. When I left the hospital, I was discharged. I couldn't do much. I was always lying down. And like I do physical work, like demanding gardening or things like that, I just get tired fairly fast. I just read a lot also about the energy problem of people who had stroke. It's very frustrating.
I wonder how common that is. I mean, is there a commonality with your experience with most people in hospital beds that they have to go through the indignity? So that's sort of...
Yeah, everybody has.
Yeah, no, having that yourself. If somebody in the hospital bed says to you that you know something about the same sort of thing, that the indignity of it all, then you can understand it.
I totally can empathise with that, and I think if you keep trying to be mobile and keep going, doing exercises to strengthen your body while you're in the bed, that's the thing. I did that. I had, well, I wouldn't say this to the patient because it's up to them, but I had tins of Heinz beans that I spent all day long doing this and on my feet, getting myself strong again. So you've got to keep push, 6 o'clock in the morning. That's the only way to get there. But I don't know if I'd be allowed to say that. I'd be asking your advice. Tins of Heinz beans would be they'd be very happy because they'd be selling lots of tins, wouldn't they, in the supermarket? But that got me strong. It really did.
So what are you suggesting that you want to say to people? It's good to do that?
Yeah. And I had the soft balls that I squeezed to get my hands moving again. They didn't move like that, but so, and just it worked. When I woke up in the morning, I had to be doing exercises in the bed to get my body strong again.
And I guess a theme that comes through that is about determination and the importance of putting in the effort for an exercise program when maybe you feel like not doing it.
That's right, you don't feel like doing it.
But just, advising them to do whatever their physio or OT has
whatever they've
prescribed to them to do. But that theme of keep trying even when you don't feel like
That's
it, and it does get results.
It's the only way. Well, I don't know if you remember, Michelle, but my eye was completely shut, wasn't it? And I couldn't see out the eye. And so I had to lift the eye up, and her pupil was in the corner, and bring the eye round. It took months to get the eye round. But I kept doing it all the time, all day, all night, just brought that eye round. And it came, and even the consultant said he never known it. But my physio, she said it's a muscle and we'll work on it. She gave me that hope. Yeah.
And that lived experience that you've got, that can be translated to pretty much everyone who's had a stroke, because everyone needs that encouragement to do their exercises, to be determined and to put in the hard work.
Yeah, because you do get ups and downs and waves. You know, some days you don't want to do it, and so you know the next day is another new day. You just take one day at a time. You do get bad days, really bad days. We're all human.
My advice is there's nothing wrong at all in saying to a patient in a hospital bed, one of the great things that I learnt was that by persisting with exercises, I began to get some strength back and so on. There's nothing that, I think that's a good thing to do. Don't expect that, I talked about the person with no legs. Be a bit careful. But I have no hesitation in a heart ward saying to a person that the best thing that's happened to me is that after my heart attack, my wife and I agreed, we'd get up early in the morning and we'd do something, whether it be riding, walking or swimming. And we've kept it up for 20 years. And that's been a great bonus. Apart from falling off the bloody bike and bashing my head.
I had a very clever explanation from my physiotherapist. I have a private physiotherapist, and about the tiredness. Like someday you feel energetic to do your exercise, another day you feel you are going backward. And he say, you know, your brain is healing. It takes a lot of energy. You don't suspect how much energy the brain takes to making do what it was used to do. And he say, like a stroke is just like a computer. You have to reboot on safe mode. I think the image was very, very good. He say,
because that's your language. He spoke your language, being a computer.
I said, this is bright. Really, I understood. So, instead of putting pressure on you, because it's frustrating, like I was training my arm, I'll say I could lift the arm very high, and so then the week after I say, ouch, it doesn't work. Say, what happened to the work I've done, you know? This you have to put in perspective. So your brain doesn't work the same way as you think it does.
And as you said before, like you asked how common the tiredness is after stroke. It's very common.
It's very common.
And most stroke survivors will really suffer with that. So the 3 first months after stroke are the most exhausting, where people, after doing little tiny things, get so tired to the point they need rest and naps after even moving things on the table or even thinking. Because as you said, the brain uses a lot of glucose, a lot of energy to do simple things which you used to do before with not thinking much about it. So tiredness is very common, and most people will have it, and it will take sometimes months, even years to come back, and sometimes you won't be back to the point you were at the beginning. So very common thing in stroke.
And I think tiredness, the feeling of constant tiredness is just the open door to depression.
Yes.
It just gets, it's very sneaky. You say, I was never depressed in my life. I say, you have to admit that you are depressed. It's very difficult. I say, that's it. It's just like you reevaluate yourself. I cannot perform and blah, 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 blah.
I think that's the worst thing that's happening to me, becoming tired. The slightest reason, I just have to walk up my steps and I feel very, very tired. And it happens all the time. In fact, every day I can be just so exhausted, doing very little things. And I dare not even vacuum the floor. If I start, I have to stop and then sit. And then always remember to drink lots and lots of water and have my rest. So I can never complete a job. I have to stop because I'm always very tired, and with the tiredness is the giddiness. So, and I'm just so afraid to fall. So I hang on to things And to me, it is just so abnormal because it's not me holding on to things and feeling so giddy. Everything seems to be swimming, and that was the sign that I had when I ended up in hospital. All that vomiting, all that giddiness. So it keeps coming back. And then when I'm giddy or when I'm tired, then I get all the palpitations. My heart starts to palpitate, and then I get so worried that I'm going to get another clot. Because as the specialist said to me, I'm very, very prone to blood clotting. I've had 2 experiences already, one in the brain and one in my artery in the left leg. I had a big operation on that. So I'm very, very aware. So every time I feel giddy or I'm tired, I quickly rest because I tell myself, if I don't, I will fall. And that's the worst thing that could happen to me if I fall. And my children and my husband will always tell me, you are doing very, very well. You have improved a lot. You make sure you don't have a fall because that will set you back, a lot. So I'm always, as I said, always giddy, even now, And then I follow my husband when he has a dance session. I can't even watch the people dancing because with them turning around, I'm just so giddy. I have to turn away. And so that is my worry. I mean, it's a year already, and I get so giddy all the time.
Could I just ask a question, just for my curiosity? How long ago did you have your stroke? And each one too. What time frame are we talking about?
Oh, mine was last year, April, so it's just one year.
1 year. Yeah, you probably said that and I'd forgotten it. So
Yes.
1 year for you. How long, Sylvia?
Mine was 2011. June.
4 years ago.
June. Yeah,
4 years
ago.
4
years
4
ago.
years.
Are you like the other two, get tired quickly or not
Well,
so
I'm
much?
70, so I think it's my age.
But did it ring a bell about their lack of energy? It did, for you too.
Yes.
Yeah. And when did you have your stroke?
Past July 2014.
So it's not even a year ago.
No. 9 months, 8 months, 9 months.
Yeah. No, it's just interesting. I just wondered whether what you were talking about is something which is sort of would take a lot longer to overcome. I mean, you're talking about, in your case, your energy level may or may not increase.
Oh, well, right now it's okay. Like I don't have to lie down
So much.
all the time.
Yeah.
Like I walk from Mount Lawley to the city, and
Yeah.
I do long walks now.
But from what was said, you can safely assume that the people you might be talking to in this hospital will know what you mean, or that they've got the energy problem too, and also if they're anything like I am, they hate the indignities that are obviously necessary to keep all your bodily functions working, So there is a commonality, irrespective of the differences. That's interesting that should be the case, that we are all open to those possibilities as well as all the other things.
At night when I wake up to go to the toilet, I don't just get up and then go to the toilet. For quite a number of months, I had to wake my husband up to help me to go to the toilet, just to be there for me, because I was just, not walking straight. I'm just walking like a drunkard, just left, right, the whole time. And then some days I feel so good, so I say, right, I think I'll go to the shopping center and I'll tell my husband to leave me there for a couple of hours. But after half an hour, I'm sitting down, I'm ringing him to come and take me back. Because again, the giddiness is there. So you never know when it's going to happen. As I said, it's practically every day, So, and I just wonder when it is going to stop, when I'm going to be my normal self again,
Well,
And no one got the answer.
No,
That's the
nobody
thing.
knows.
Yeah.
Because every stroke is different, every patient is different, and as I mentioned, some people will never regain it, Some people will, some with shorter time, some with longer. We just have to wait and see.
Yes.
And the thing is that the specialist keeps changing my medication. So that's another thing that is quite confusing for me. You know, I have very low blood pressure, and then he said it's got to be even lower so that you don't get your atrial fibrillation. So when it is very low, that's why I'm just so giddy. So I said, I cannot function, you know. I dare not even walk, you know, from the kitchen to the lounge without hanging on to things because I'm just so giddy. So he said, we'll try this, we'll try that. So I'm all the time having my medication changed. So, you know, I keep telling myself, it's not quite right yet. But as long as he tells me what to take, I will be taking, you know. So that's my problem, feeling giddy and very, very unsteady.
Yes.
No balance. Yes.
It's probably of not all that great value to, but one of the things we do with heart patients is that because they're like that, they have a lot of medication to take. We offer them a card, and if you want to, write on the back of the card what you're taking, fold it up, put it in your purse or your wallet, and if anybody says what you're on, just bring out the card. I carry one all the time with
So
me.
do I.
Because they keep changing the names of them and all sorts of things. But there are people are very pleased to have something like that but you probably do the same sort of thing with people leaving hospital. They'd get a schedule of some sort
Good idea.
Yeah.
I listened to what you just said. That was very interesting when you was asking when the giddiness would finish. I can't remember the actual words you said, but you were more or less saying, because I think this may be a question a patient would say, or when am I going to feel better, or when am I, you know, what did you say?
Yeah, as we said,
you said that.
as I said
very
before,
interesting.
none of us know really the answer, because each of us are different, and the dizziness or feeling the exhaustion can resolve at one point, but it may not. But we don't want really to put them in the negative thing, or it will not. But let's just say in general, we just have to give it time and see when it may happen, because none of us know, and not even doctor or specialist will tell you, oh, this will stop in 2 months. None of us can diagnose that, because we're all very different, and even sometimes we had patients with the same stroke, but they had very different symptoms at the end, and the recovery period was very different as well, so we can't really even compare. We have to say in general. And I know the people would like to cling to the dates, like when we
I'll
can't say
listen to
that.
that, because somebody bound to be saying it to us at one point, when will this stop? You know, when will the tiredness stop? So
Only time will
I'll
show.
listen to that.
And I think a really good response would be, have you spoken to the doctor about that?
I mean, that's
something
a good response to
so
anything.
have you
We
spoken to doctor? Have
we
you?
had a case yesterday with Bruce when I said that I get my driver's license back. Say, what did you do with the instructor? So, and he talked about his problem of the. So I had a test with the OTO. They say, well, you tend to forget objects, you know, in the peripheral vision, and the OT instructor said there's a lot of people who have stroke. They start to drive again, and they just chop all the mirrors while driving. So they check if you're educatable. Oh, it's a complicated word to say. You can be re-educated, and they're confident we can let him drive because you can autocorrect yourself. I had 3 tests, 3 lessons. Oh, so you improve from one to the other. And the third one say, it's okay, your observation, you check the mirror, check your that spot, and you're okay.
That happened to me too.
But I think
my peripheral vision.
I might not even get it back, you know, if it's major problem with the lateral
peripheral vision.
It's
And
dangerous.
that's
It's
all
dangerous.
time,
It's dangerous.
All time, yeah.
So you cannot encourage people. You cannot
No. You
pause
just
say,
have
"Oh
to
no,
keep-
don't worry, you will get it in a couple of months."
Because they may not, yeah.
No.
So
No.
it's not
So
good
that
to
was a-
discourage them because we want to give them the hope in their heart that why not to aim for this,
Yeah,
yeah?
why
But at
not?
the same
Yeah.
time, we
You
can't
have to
give
be
them.
realistic
Yeah,
and say,
they-
"Listen, if you have a major problem of perception,
Yeah.
you're
Yeah.
you're going to be a danger for yourself and for the rest."
Yeah.
You know, when I had that cancer, my consultant was very negative. I called him the Prince of Darkness because my two sisters and my brother had the same cancer and passed away. And he knew that. And so he wrote me off. He literally wrote me off, and that's the truth. He didn't want to give me the operation. But his registrar said one thing to me, and this is all he said. When I was pretty low, I was at the end of the chemo, and I won't go into any grim details or anything, but he said to me, right, 95% die, 5% live, why not you? That's all he said. And I thought, why not me? And that's got me through it. It's making me go.
Yes.
And I wrote to him afterwards. He's now a consultant at St John of God, Dr. Feeney. And I wrote to him afterwards and I told him what he'd done. And he said, he wrote me a lovely letter back and said, thank you so much. He said, because as doctors we tend to deal with the medical and we don't realise how much the mind can
Works, yes. The
Can-
hope, you know, that you are.
yeah,
Yes.
yeah, can. So he was the one person that gave me encouragement, and that got me. I thought, yes, that's me. Why not me?
I think that's what we have to remember, yeah, like we can actually heal people with words and
Yeah.
kill them as well. It's so
Yes.
simple.
Well, it gave me the. I don't say it healed me. It gave me the best
The hope,
medication,
yeah.
but it gave me the drive to get my head round it, and yeah, and that was the best thing that could have ever happened to me. But now the Prince of Darkness is my mate. Prince of Darkness,
Of
my
Darkness.
consultant, Simon Truly. We're friends now. And because he said it's good to get a result. He's, you know, we're good friends now. There's no animosity. But, yeah, so I had a lovely letter back from Dr. Feeney, and he's an oncology consultant now at St John of God. So.
Just go back a step. I think for what I've picked up is the question, how much can you communicate to people about things that have worked for you? And it was a question of exercise and everything else. It seems to me that there's nothing wrong at all, provided that you say, you know, what's worked for me, it may not work for you, but I found it was a great value to be able to be determined about something or to have exercise or whatever it is that's been a positive thing for you, but not assuming that it would be appropriate for that person. You don't want to set up a guilt thing for the people so that, well, you know, I can't do that, therefore there's something wrong with me. So it really has to be quite clear that all you're saying is that this has worked for me. But if you want to get advice about it, you ask the professionals about it, and so not me. I'm just explaining how what path I've travelled on myself. But yeah.
Well, I guess you make the point that we have to the patient has to understand that there is a part that it just belongs to him.
Yep.
He's part of the healing process. So that's all we can transmit. Say, I did that to myself. You observe yourself, and everybody has to observe yourself. Oh, I should try this. I should try that. Go on. Use your imagination and
Yeah.
because people tend to be passive. Oh, I'm sick. So they wait for the outside to do all the job. So that's basically the thing. You cannot exchange recipe.
Yeah, that's,
Doesn't work.
yeah. And that's simply your job as a volunteer, to support them and maybe help them to see the light at the end of the tunnel. That they can keep doing things to keep improving. You can't tell them how far they can get because none of us know.
No.
But you can actually encourage them to participate in therapy. It's like I'm finding recently when I'm doing the hope jars for the stroke patients, some of them, the physio came to me the other day and said, Elena, you gave the hope jar, you talked to the patient and he didn't want to participate in therapy for a few days. After this conversation about the hope jar, he said, I want to do it now. And what we've done, I asked the patient, what's your goal? And I'm interested in a big goal. I know you had little steps, but I said, what's your big goal? And he said, oh, my big goal is, and he told me that. And he said, oh, well, I know I never get that. I said, no, let's leave this for later. I said, let's write this goal on the piece of paper, put it in the jar, and we put it up there. I said, look at it every day and think to yourself and say to yourself, that's my goal. I have to take the little steps on the way. Maybe I will get there, maybe not, but it's only me as the patient who can decide to give up on that goal. I said, don't let any of us, all the therapists, tell you how far you can get. It's only you who will determine how far you may get. And I said, when you decide one day you want to really give up on this goal, smash the jar, forget about it. But take it home and always remember that's the thing, that's your goal.
What was his goal?
Interesting technique, yes.
His goal was to go in the garden, be able to kneel on his knees and go into the ground, touch the ground simply.
Yeah, that seems such a simple goal, but that's
But not for him.
that's something he really wants to do.
And that's what I've realized. I've read lots of research about hope, and that's what I found out. People who set their goals really high, they getting much further than those ones who set their goals very little. Because when they're setting their goals like 100%, they may get to 85%, yeah? But if they're setting just 65, they're only getting like 40. So
Think big.
think big, and that's the big thing in stroke. Because as you know, the hope is so important. Like the consultant said to you, you're the 5%. And it stuck to your mind like, why not me?
It made me grow. I felt myself.
So that's important. And that's why you're there to support these people, to empower them.
Yeah.
Yeah.
You have to believe in yourself. You can do it and then try.
And then you can
Just
help
keep
others,
trying,
yeah.
yes.
That's right.
That's
Nobody
me,
else
you know, you have to
can.
be
It's
determined.
nobody else can do it. Only you.
I think, did I tell you about the role play that I organised between a policeman and a prostitute? No. It was interesting. It was a human relations course, and well, when I say prostitute, this girl had a very wild life, and I think she had a child, and she was a single mum, and so on. And there was a policeman also present there, and he was really rough and gruff about. And in the group discussion, you'd look at the girl and say, you know, why don't you grow up and stop behaving the way you've been behaving all this way, and you're only a problem, and you're going to be a problem all your life, and so on, you see. So we had a role play, and I said to the policeman, you have to be the girl, and she's going to be the policeman. The transformation was incredible, because he had to put himself in the position of seeing life as a person with her background. And she tried to see life through the ideas of a copper who was supposed to uphold the law. And it was, he actually, it shook him greatly when he realised that having a different perception made you actually change your behaviour quite dramatically. But it was a really strange experience.